Ticks are small, brown parasites that live in wooded areas and fields. These organisms need blood from humans or animals to survive. Ticks attach to your skin and suck your blood. They prefer warm, moist areas, such as your scalp, armpits, or groin. The tick sits on tall grass and trees, waiting for a possible host, such as a human, to walk by. If a tick attaches itself to someone, it will typically find its way to a warm, moist and dark place on the body like the crotch or the armpit. Often the person carrying the tick is completely unaware it is attached to them. The tick will then insert a probe into the skin and begin sucking blood. In most cases the tick will leave after a while, simply by disconnecting and falling off the skin, or the host will get rid of it without any harm having been done. Unfortunately, ticks also tend to be carriers of diseases and can pass these diseases on to the people they bite. According to the Centers for Disease Control and Prevention, some ticks carry the bacteria that lead to Lyme disease, which is a debilitating infection. You don't automatically contract Lyme disease if a tick bites you. Ticks are parasitic in nature and they attach themselves to a host to drain their blood. Hosts include birds, reptiles, amphibians, and mammals, like you. Not every tick carries disease. However, it's important to remove a tick to stop it from potentially infecting you with a disease, or from causing any infection at the bite site. Removal also ensures that the tick doesn't go on to breed in your home, causing an infestation. Tick removal is a simple process that you can easily do at home without any special products or medications. A tick on the body doesn't usually cause any pain. In many cases, you may not realize you have a tick on you unless you see it on your skin. The best approach for removal is as follows. Do not handle the tick directly. Use fine tweezers and avoid blunt eyebrow tweezers. Gloves may be a suitable alternative if tweezers are unavailable and the tick is large enough to grasp with your fingers. Hold the tick as close to its mouthparts as possible. It will be these parts that are attached to the skin. Do not squeeze the distended belly of the tick, as this could cause fluid to be squeezed into your body and increase the risk of disease transmission. Gently pull the tick away from your body. Do not twist it, as this may snap off the mouthparts, which will remain in your skin and pose a risk of transmitting pathogens. If the mouthparts of the tick remain in the skin, try to remove them with the tweezers. Keep the tick in a dry jar, pill bottle, or zipper storage bag should later identification be needed. Store the tick for up to 10 days in the freezer or refrigerator, and label it with the bite date and location. Wash your hands and the area of the bite with warm, soapy water. You may want to use an antibiotic ointment on the area for extra protection. Continue to check the rest of your body for ticks. If you have been bitten by a tick and have removed it, the risk of getting Lyme disease is so small that there is no reason to use an antibiotic. It is, however, important to watch out for symptoms that may indicate Lyme disease, especially a red spot close to the tick bite. The spot gradually gets bigger and, eventually, a pale area will appear in the middle. It isn't usually itchy, painful or hot. This is often accompanied by headache and fever, which will usually appear between 3 and 30 days after the bite. If this happens, see a doctor immediately. Once the diagnosis is confirmed, most people need a 2 to 4 week course of antibiotics to treat Lyme disease. If the disease is severe or in its later stages, intravenous antibiotics may need to be given. It's important when out walking in the countryside, especially in wooded or heath areas known to be a risk for Lyme disease, to take precautions to avoid ticks. This might include using insect repellents, covering up the skin with trousers tucked into walking boots or wearing long sleeves, sticking to paths whenever possible, and wearing light-colored clothes so ticks are easier to spot and brush off. It's also important after a walk to check yourself and the rest of the family, including the dog, for ticks, because people often don't immediately notice when one has attached itself to their skin.